why did you choose the profession of ENT?
I'm from a village background. My childhood was humble, and of course, there were no doctors in my village.
What is ENT?
ENT includes ear, nose, and throat. It doesn't include eye. Even in India, we deal with a lot of issues like salivary glands and thyroid issues, and other even the cancers of the head.
What are some of the common allergies that you see when it comes to nose and throat?
Allergy we broadly classify into seasonal and perennial. So seasonal we see in particular season like flowering season mainly. Whereas perennial means it is most commonly to our household work, especially this dust and the pets who ride a two-wheeler and they don't wear the helmets. So these people are at higher risk of developing these fractures of the mandible, this jawbone, and the fractures of the temporal bone. So addiction is one more thing which can comfortably avoid many diseases because smoke is one thing which can kill the person as well as the family.
Welcoming you all to the Poster Show, where we bring in deep insights to the topic that matters to us. Our today's guest is an accomplished ENT, Dr. Vadish Bhat, and we are going to discuss on hearing loss, allergies, and how to keep your voice in TikTok shape. So let's get started. Welcoming you, sir. It's a pleasure to have you.
Thank you. Pleasure is mine too.
So, initially, we wanted to know why did you choose the profession of ENT?
Yeah. First of all, I should tell that why did I choose medicine? I'm from a village background. My childhood was humble, and of course, there were no doctors in my village, and I had to move ahead. And of course, there was parental support for me, and of course, then I could succeed in getting a government medical seat, and I could complete my MBBS. Then, of course, when you get something, you need more. So then, of course, the post graduation was one more aspect of our life. So during MBBS, we had one of the very good department in our medical college was ENT, and there were interesting things going in that. And I wanted to go for a broader specialty rather than going in a very narrow. And during that time, the ENT was an evolving branch. So apart from the ear, nose, throat, people were started expanding the horizons of this ENT, and people even touched the skull base and the neck and other aspects of the health. So I naturally got interested in that, and I could get a very good seat in one of the largest general hospital in Asia, that is the BJ Medical College, Ahmedabad, and that is how my ENT journey started in 2002.
Okay. And why did you choose specifically ENT?
As such, there is no specifically ENT. See, if you ask me, my first choice when I was during MBBS, during first and secondary, it was pediatrics. I wanted to be a pediatrician because I used to love kids. Somehow later, and I understood that it is a very demanding branch, and if you want to get those pediatric, then you have to be really very intelligent, and you should be in the topmost thing, being in a general merit student. And I was probably not in that, and I couldn't afford to pay a hefty fees for getting MD pediatrics in a private medical college. And of course, I found this ENT is like we have enough to work in this ENT, and that is how I could satisfy myself by taking ENT.
So, for general public, what is ENT?
ENT includes ear, nose, and throat. It doesn't include eye. That is one thing which I wanted to tell you, because many times some random people come to me saying the eye complaint, thinking that ENT includes eye. No, ENT is ear, nose, and throat. The scientific terminology is otorhinolaryngology. Oto means ear, rhino means nose, and laryngology means the larynx, throat. Uh, Ear means we deal with the disease of the ear, external ear, middle ear, and inner ear. And now, as I mentioned already, we expand our field, even going to the skull base surgeries in the ear. And nose includes the diseases of the external nose, as well as the inner nose, like our nasal polyposis and other diseases, sinus related issues, and the external nose, including the deviation of the nose, which can cause some disfigurement of the face. And in the throat we have lot, like again as I mentioned earlier, as we expand our horizons, we have diseases limited to the oral cavity, disease of the oropharynx, then voice box, that is larynx, and even we include head and neck as a this ENT. Now earlier in western countries, of course, it is a part of ENT, no? But even in India we deal with a lot of issues like salivary glands and thyroid issues, and other, even the cancers of the head and neck. So that is how ENT, though it sounds like a very tiny things, but there is a lot more to give to the society in ENT.
Why do people start sneezing when they wake up?
Yeah, you rightly pointed out that when they wake up. See, when you say that when they wake up, that means a kind of an allergy which is there within their home. So the sneezing when they wake up means it's a perennial allergy. There are two types of allergy. Basically, one is a seasonal allergic rhinitis and the other is a perennial allergic rhinitis. Of course, the older classification, but now it is good for a general public. If I mention this, that would be right. Season means it starts in particular season, but perennial means the allergen there within our home. It may be the just dust mite which is there in our bedsheet. Of course, we think that our bedsheets are absolutely clean. We wash it twice a week and so, but still there are some dust mites which can cause allergy. So that is one of the important cause of sneezing in the morning. And the, the perennial allergic rhinitis is the cause. And of course, there are some like early morning because of the change in the temperature, the cold temperature, especially when they switch on the AC. So congestion will be more during early morning. So that is the other cause what I can say.
So, when it comes to nose blockage, which is
Yes.
according to the season, why does that happen?
Again, the nose block can be seasonal or throughout. So nose block, there are plenty of causes. We can start like this. There are some conditions which can cause block in one side, and some conditions which can block both the nasal cavities. Sometimes the most common thing what we see in our people is the deviation of the nasal septum. The septum is the part which separates the two nasal cavities. When it is bent to other side, either the during from birth or during some childhood trauma, so they may have deviation to one side and they tend to breathe from one nose. There are some like allergic rhinitis and nasal polyposis where they breathe, they'll have problem breathing through both the nasal cavities. In small kids especially, we often see people, they won't say that they can't breathe through the nose, but they keep their mouth open to breathe. So that is called adenoid hypertrophy. So these are some of the common causes of this one. Of course, we need to evaluate each person with the nasal block to come to the diagnosis of particular condition.
Right. And we've seen that some people have tilted nose from their childhood.
Yes.
How does that affect?
Yeah, tilted nose. Again, there are two things. One is only the external nose tilted. Second is, as I mentioned earlier, the septum also being tilted. So people with the tilted nose, along with the tilted septum, will have both cosmetic change as well as the nose block. So those cases actually needs correction. So now again, when we say correction, we cannot do it in very early childhood. We wait for the surgical correction of the nose till the age of 16 years, because that is when the development of the face gets completed. If we assault the nose in early childhood, that may cause problem in the development of the face. So we avoid touching surgical any nose before 16, and after that we can do a surgical correction of the septum, that is called septoplasty, what we say, and the surgical correction of the external nose, that is called rhinoplasty. So both are done usually after the age of 16 years. 16, 17 years is a safer age to do these procedures.
So, in short, if you could explain both the surgeries that you mentioned for the general public to understand what's being done in that.
Yes. So, of course, plastic means usually we think it is some kind of plastic surgery. The septoplasty is not that great. See, the problem in the deviated septum, the septum being bent to one side, is the abnormal. There is abnormal growth or some extra growth of the cartilage what that forms the septum. So what we do here is we open the mucosa, only the skin line part inside, and we lift the skin and we remove that part of the septum which is deviated. Only that part which is deviated is removed, and we replace the skin. So that is done. So the deviation is corrected, and both the nasal cavities are they come to they function properly, and we don't have to bring exactly in the midline. So that is what we always say, because that is not required. What we intend is to uh, give airway, comfortable airway from both the nasal cavities. That is about the septoplasty. When it comes to rhinoplasty, it is a little complicated procedure because that depends on particular person. So it varies from people to people, that what kind of deformity they have. Based on that, we decide what to do. Some people will have hump in the nose. Some people will have tilted nose. Some people will have depressed nose. So depending on that, we do corrective rhinoplasties. It may be a reduction rhinoplasty where we remove part of the things, like we lift the skin. We don't do any external scar. So because the main purpose of doing a rhinoplasty is uh, for the correction, for beautification. So we don't make any scars, but we hide the scar and lift the skin, and we remove part of the skeleton, so that the, we need we meet the requirement of the person. And sometimes when there is a depression, so then we may have to put something to fill the gap. So that is usually in people who had some injury in childhood, like or early childhood or maybe late childhood, when they have fall or something. So if there is any depression, we take some graft from somewhere and keep it. So the graft we may take from the ear cartilage. Sometimes we take from the rib cartilage. So those grafts are used for filling the gap, and then we replace the skin and suture. So a little complicated, little tricky procedure. Of course, not every ENT surgeon deal with the external like this rhinoplasty surgeries, but few of us still do.
What are some of the common allergies that you see when it comes to nose and throat?
Okay, so now allergy we broadly classify into seasonal and perennial. So seasonal we see in particular season, like flowering season mainly. So when some plants start flowering, people will come to us saying that they have sneezing and itching and other things. Whereas perennial means it is most commonly to our household work, especially this dust and the pets. So that is one thing which always ask when people come with the perennial allergy: do we have any pets? Because one studies say that even we take out the pet, the allergy due to the pet may remain for 6 months even after we take out the pet from the house. So that thing we need to consider when person has a perennial allergic rhinitis. And when it comes to throat again, so usually one airway, one disease. Like the allergic rhinitis can also cause effect in the nose in the form of itching. I mean the throat in the form of itching in the throat and hawking cough and all. So that is again because the same allergen affecting both the nose as well as the throat. And many times effect may be indirect, like main target organ is the nose, but whenever there is an allergy, the secretions trickle in the throat and person start coughing. That is the secondary effect of this allergic rhinitis.
Right. And why does the nose get blocked?
Yeah, nose block. See, our nose is a wonderful structure. So only God can make a perfect nose. So no one else can do it. Because if we consider the nose, we have the lining skin and we have a skeleton. And inside it is a totally a complicated structure and no architect can make it. And there are again inside the bones are bent in such a way that it provides a perfect, it gives a perfect air to the lungs. So it humidifies the air, it filters the air which we breathe in, and it air conditions the air. So these are the important structures, functions of our nose. And for that, we have a lot of complicated structure like the mucosal lining, and underneath there are enough blood vessels where the blood is flowing like anything. And nose is one of the richly vascular, like there is a lot of blood supply to the nose, so that The air is filtered, air conditioned, and humidified inside. Now, as you mentioned, we're concerned more about the nose block. So problem from the nose block may be the skeletal issues, or it may be mucosal issues. So when the skeleton means the deviation septum, I already mentioned it, and the mucosal issues may be allergic rhinitis. When we get allergy, the mucosa gets swollen, so that causes block of both the nasal cavities. Sometimes we see some polyp, like a new growth. Basically, they are not a new growth. The mucosa gets swollen so much that it starts hanging. So that is called polyp. That is one important cause of, or we can call it as a sequelae of the allergic rhinitis. And sometimes in kids, of course, the allergic rhinitis. And sometimes in an elderly, if they start with the nasal occlusion, we have to evaluate thoroughly, because it may be a new growth developing within the nose, wherein we need to have a more suspicion and evaluate it thoroughly, because we cannot rule out even a tumor developing within the nose.
And what are some of the home remedies which one can actually do if he or she is having or experiencing nose blockage on a regular basis?
Okay. Basically, uh, we cannot, as a blanket therapy, advise home remedies, because we need to know what is the cause. Of course, if it's allergic rhinitis, first thing, the best possible treatment is avoid allergens. That we do, even though it is not a remedy, but it is a best possible precaution what they can do. For that, they need to identify what is the allergen causing the issues. Then only they can go ahead with that. Second, some people will have this issue, like they switch on the AC and sleep, and midnight they start having too much of a nose block. So one thing what we advise them as an emergency, that they have to do a rebreathing, like keep a kerchief in front of the nose and breathe in and rebreathe the air what we have expired. So by that way, there will be temporary relief. But per se, I won't recommend any home remedy, particularly for this. Of course, there are few who get benefit with the water vapor inhalation, but even that need be little careful, that too much of inhalation of the steam, again, it is not that good, because that may paralyze the cilia, the tiny structures in the nose, and that again adversely affect the person.
Hmm. So, when it comes to allergies, how does one identify their allergies?
Identification first, if we ask the person when they get the symptoms, that will provide us the clue many times, but it is not always possible to find the allergen based on the patient's patient history. Next, there are certain tests. So one of the popular test that is a commonly performed test is the skin prick test. So we have a set of allergens prepared, and we dip a needle, tiny needle in that, and we prick the skin of the plant, I mean the forearm. So we mark the site and what allergen we have introduced, inoculated there, and based on the reaction we find whether they are allergic to that particular substance or not. And it is a tedious procedure, like it is not very simple, and we cannot definitely say that all problem is because of this. Many times what we do is the allergy, the kit provides some 20 to 40 allergens, but person may be having a 51 allergen, so that we are not testing. So that is why allergy is always a enigmatic condition what we call. But nowadays we have further testing like IgE. It is a immunoglobulin, and general immunoglobulin, of course, any allergen, the Ig will be elevated. But now we have specific allergy IgEs. By assessing that specific IgE, we can have a fair conclusion that person is particularly allergic to this particular allergen.
And once an allergy test is done and he or she is detected with one particular allergy, how often should he repeat the test? One, and is it that he's having that allergy today, but after 2 years it's not there in the body?
It is possible. It is possible for two reasons. One is, if he migrates to a new place, entirely he will be eliminated from the earlier allergy. That allergen, he won't be exposed at all. That is one. Second is, if the sole purpose of this identification is considering the further treatment. So what the treatment options available now are the desensitization. When we know that definitely this is the allergen causing problem. Then we can desensitize that. Again, it is a long procedure, year-long procedure, where we inoculate the small amount of allergy to them so that they get used to that. It's like a tachyphylaxis. It is a therapy where a small dose is given every day. Either nowadays we have simpler options also. Enough we can given we can introduce in the form of nasal spray also, and even the oral. There are some pellets comes immunotherapy, what we call that, is kept under the tongue, and slowly it starts working. And but we need lot of patience in dealing with these people. Of course, both the doctors as well as the patient need to be very patient in this.
Okay. And when it comes to nasal spray, is it safe to regularly use it for a very long time?
Yes, this question I get in every OPD. Like, and many times there is called nasal spray abuse. So we have, of course, I cannot tell the trade name of any of the nasal sprays. Of course, we see that even we get advertisement in the TV also. But those sprays are actually not to be used for long periods. So decongestant nasal spray have to be used for short periods. Only their emergency drugs like oxymetazoline and xylometazoline are the drugs. So if we use it for very long time, in fact, they'll adversely affect us. Like there is something called rhinitis medicamentosa that later, after a particular time, initially it will give a magical relief. When we use the spray, yes, absolutely the block is gone and we can sleep very well. But when we abuse that, after a few months, then we cannot sleep because the entire nose become completely blocked, and we can easily ask the patient that are you using this spray for more than 3 months. That is how it goes. But there are other sprays like, of course, now you don't jump, like it is a steroid nasal spray, and that is actually to be used for longer period. The allergic rhinitis and nasal polyposis are conditions where we prescribe steroid nasal intranasal steroid for very long period, maybe in years. That is actually a safer drug rather than the other decongestant nasal sprays.
So, how do you identify the difference between both? Like a
Yeah.
common man,
Yes,
I
see, that's what. I don't recommend over the counter medication for any nasal obstruction because it is crucial to identify what is there. Then only we can treat a person with the polyp. For example, I'm giving a person is having a polyp, he's having nasal block. He goes to a shop and he asks for the decongestant sprays. Of course, here in India, it is, and of course, the TV we see advertisement. Of course, it is not a crime to buy a decongestant spray. He starts using the spray and he gets very good relief. So he's happy that the drug is working, and he continues to use. So what happens is this drug will not act on the polyp, but it will act on the other area, and it causes squeezing of the rest of the nasal mucosa and provides airway for him. But the polyp will continue to grow. Meanwhile, after a certain period, the other mucosa also gets disturbed. So that is how we need to avoid using these decongestant nasal sprays. But I can. It's difficult for me to tell now here what they have to use. It is always better to have a consultation and then decide.
coming to some people where they start breathing from mouth for a very long time. How do you see that?
Yes. See, when the nose is blocked automatically, we tend to breathe through the mouth. A newborn cannot breathe through the mouth. So newborn, if there is any problem, like some congenital, the problem will be there even when born, like a choanal atresia. So that becomes an emergency. Apart from that, the adults, if there is any problem, they tend to breathe through the mouth. And now, forget about the adults. The adult will consider a kid of around 2 3 years. So if they start breathing through the mouth, and the common cause of this issue is the adenoid hypertrophy. Adenoid is a tiny tonsillar tissue which is there behind the nose and above the mouth, and at the junction of the nose and the mouth. And if the kid has enlarged adenoid, automatically they'll breathe through the mouth. They'll keep the mouth open, especially at night. Daytime somehow they can breathe through because breathing in is a active process. They can breathe, but in night they'll have problem with the nose block and they tend to breathe through the mouth. So the prolonged mouth breathing can lead to certain facial changes. One is their teeth become projecting, that is, and their nose become elongated, and their nose become non-functional because they are not breathing nose. It starts become flatter, and of course, apart from that, there are some other problems also. Like when they breathe through the mouth, unfiltered air goes in. So as I mentioned, the nose is a very important structure which provides us the humidified, filtered, and air conditions air, and that is not there when we breathe through the nose. So that causes certain other features like a drying of the airway, nocturnal night coughing, cough in the night, and other things. And over a prolonged period, they can even have other issues like sleep apnea. So that is altogether a different condition where we need to closely monitor the patient and evaluate.
So, what is sleep apnea?
Sleep apnea in children, if I start from the smaller age group, the adenoid can cause very too much of enlargement of the adenoid, and person has to breathe through the mouth. But breathing is not very comfortable, and night their sleep get disturbed. So they tend to wake up either completely or partially. It goes like this: they sleep, after some time they start snoring, and after particular time the snoring, they are still breathing, but at one particular time it stops, and the sleep get disturbed and they wake up from the sleep. Then again they may either completely wake up or partially wake up, like just they wake up and again go to sleep, and this cycle repeats sometimes 20-30 times per minute also. So that I mean per hour also, that means every 2 minutes they are waking up. So this causes a disturbed sleep, and that is what we call it as a sleep disorder breathing or obstructive sleep apnea. So because of the obstruction in the nose, throat, or in the lower air, in the larynx, so their sleep get disturbed, and over a period, the sleeplessness can harm our many systems like the heart, and they may get early blood pressure, hypertension. The chance of getting diabetes is also very high, and especially the cardiac diseases. This is because during night, no sleep, and adrenaline. There's one substance called adrenaline is increased in our body, so that adrenaline can affect all these systems.
Some people breathe very fast and heavy. How do you
Okay.
find it related to ENT, and what
Mm.
can be the reasons or what can be the causes affecting their overall health?
Okay, breathing heavy, especially mouth. So if it is breathing through the nose, there will be some limit. But when it is breathing through the mouth, of course, it will cause definitely ill effect on the lower airways, because one airway, one disease. So especially our allergic rhinitis can cause nose as well as the lower airway effect. And in the nose we call it as allergy, and in the lower airways we call it as asthma. So that could be one of the cause, one of the indication of having a lower airway problem in this particular patient. But the voluntarily breathing through the nose, that should not actually cause any issues. But breathing heavy means like during exercise naturally we tend to breathe, but the mouth breathing is one thing which we better avoid, and we need to breathe through the natural passage only.
Coming to fever, we've seen that we lose the taste of smell, the nose is not functioning, and we cannot taste anything well. Why does that happen?
I think after 2020, many of are expert in this, because that is the hot topic of COVID-19. And see, earlier also it was there, but COVID taught us so many lessons, and people start investigating about that. Of course, any viral infection can cause a nasal stuffiness. So whenever there is nasal stuffiness, the aroma we cannot perceive, the smell we cannot perceive, and naturally the taste also goes down. Not only that, whenever there is a fever, there will be some inflammatory reaction that is happening in our body. So that will reduce our taste sensation also. That will prevent, or that will reduce the binding of our odorants, the substances what we smell and the substances what we taste, to the particular receptors. So there is, for everything there is a receptor here. In the nose we have smell receptors. In the tongue, in particular areas of the tongue we have different receptors. the front has a receptor for sweet, as well as the back of the tongue has receptor for bitter taste, and the sides we have receptors for the sour taste. So based on this, the binding of the receptors of and the substances, they reduce because of the chemical mediators. So temporarily we tend to lose the taste in when we have fever, and that is why we don't feel like eating. And of course, the block in the nose and the resultant the decrease in the smell sensation adds to this. The overall flavor we won't be able to taste.
Coming to tonsils, if you could explain our general public what is tonsils and why does that happen?
Yeah. Again, tonsil is not alone. So it is an army. Basically, the commonly what we say tonsil is in the throat. Like what we can see, most of us can see when we open the mouth wide open. And along with the tonsil, we have certain other tonsils. We have the adenoid, what I mentioned now, it is called nasopharyngeal tonsils. We have something on the tongue base. We have that is called lingual tonsil, and even behind the throat, if you see clearly, there are some tiny elevations. They are called pharyngeal lymphatic bands. So this is very important for us during our early life. So they are army, like they stop anyone coming from outside. The infective agents are stopped there, and they're taken care of. And during that period, our immunity develops. Those tonsils are essential for immunity, but remember, only in early life. After 5 years, absolutely useless things. They don't have any work, because by that time our immunity is well developed. Sometimes they started troubling us. Like, tonsil is not a simple thing. It is not a smooth structure. There are so many depressions in that. So easily gets infected. So even when we go out and for a dinner, or even a contaminated water can cause tonsil infections. The tonsil infection is called a tonsillitis. Again, once a while getting a tonsil infection is not a big deal, because we can comfortably treat it with an antibacterial medication, or many times it is a viral that gets controlled on its own within a week. But repeated infection is usually because of the bacterial infection. That too, the bacteria is embedded within the tonsils and getting reactivated whenever there is an opportunity. Those are called chronic tonsillitis, where we may have to surgically remove them. So that is about the tonsillitis. And along with that, what I mentioned earlier is the adenoid. So adenoid is it is not, it cannot be seen, and it can be seen either when we do a nasal endoscopy or when we take an X-ray. So then only we can show the person that, of course, look here, you have, or your kid has a adenoid hypertrophy. That need to be surgically corrected to provide the comfortable airway. So tonsils can be managed medically most of the time where it is infected. But if the number of infections is too much, then we may have to surgically remove it.
And somebody who's having tonsils regularly, can that be a cause of throat cancer? Are they linked?
Not directly. Of course, tonsil is a site of cancer. So one of the in Western, of course, because of their sexual behavior, tonsil are one of the common cause of infection because of their HPV infection. But in our setup, it is still not a very common site. But of course, we see cancers of the tonsils. But having frequent tonsillitis is not a proven cause of cancers as such. But of course, whenever we have a problem with the tonsil, it is wiser to get it examined to see how it is. And of course, if the person is having high risk behavior like smoking and alcohol, then of course we need to be doubly sure about that there is nothing major in the tonsils.
So tonsil could be a symptom which is showing that the throat is having a cancer.
It is very much possible. Many times we have, of course, I would appreciate you for asking this question. Many times people come to us saying that just the throat irritation, but when we examine, it is actually a cancer. So that is true. A persistent throat irritation, simple throat irritation, because the throat is a larger area. It is not a very tiny area. So even till the growth, of course, there is a growth developing in the throat. It reaches a substantial size. We may not feel that there is something there. So persistent irritation. Of course, once a while everyone will get persistent irritation in a particular site. needs evaluation.
So, when it comes to throat, what are some of the remedies which one can take care for a healthy throat on a day to day life?
Yeah. Throat care again. Again, we cannot give a blanket advice for everyone. Some people come to us saying that whenever they touch, when they take a sip of cold water, they get throat infection. So that may be true for them, but it not be true for some other person who comfortably takes cold drinks. So that is one thing, we cannot blame it comfortably. But when the person has this history, we always tell them, be sure that you take care of this, you don't have it. Or when they take some cold drink, better they, after going home, they can do gargle with either a salt water or antiseptic mouthwash, so that whatever the reactivated virus or the bacteria is eliminated. So that is one thing what we advise. And other things, everything based on their past experience.
Coming to bad breath, if one brushes daily, also, are there chances of he or she having bad breath?
Yeah. So bad breath, of course, you have given half answer. One of the most common cause of bad breath is the dental hygiene. Orodental hygiene, it is maintained well, the chance of getting a bad breath is less likely. But that is not the thing. Chronic tonsillitis, as I mentioned, as the tonsil is a house of our food particles and even the bacteria. So chronic tonsillitis can be one of the cause of bad breath. Secondly, the reflex, the acidity. So that again is one of the common cause of bad breath, because nowadays, because of our lifestyle, we people won't have proper food at proper time, and we tend to skip meals for various reasons, and we tend to have food at a very odd time and all. The chance of acid reflux, and of course for any other, even the stress reason, the chance of acid reflux is more, and that is one more added cause of this one. And many times we see patients with the chronic sinusitis having the sinus infection presenting in the bad breath. So that is also to be ruled out when they have persistent bad breath proven, with the in spite of having a good oral hygiene.
So, when it comes to acid reflux, what is acid reflux basically?
Yeah, our body, as I mentioned, the God is the best engineer, and it is the airway. Sorry, the food passage. Once food goes from the esophagus, that is the food pipe, to the stomach, there is a drastic change in the environment. Stomach has a very high acidity. Stomach can sustain acidity up to 4 pH. Comfortably, the 4 pH it can sustain, whereas the rest of the areas it cannot. So this, there is a tight junction between the esophagus and the stomach. And the moment food goes inside into the stomach, it closes. The gate closes. So the food cannot come out. But due to some reason, that tight junction weakens, and slowly the acid comes up from the stomach. It starts coming up to the esophagus, and when we lie down, it can come even up to the throat. So that is called acid reflux. It initially, the popular one was the gastroesophageal reflux disease. That means from the gastric, in stomach, it comes to the esophagus. But nowadays we have proven that it can come so high that even it can trickle into our airway. That is called laryngopharyngeal reflux. So that, and there are certain risk factors. One is the not ideal food habits. Second is the overweight, and having very late food and sleeping immediately after food, having little more spicy than normal in the night. So all those are higher, I mean, the risk factors for developing this reflex disease. But one person can develop without anything also. That is just because of the loosening of the tight junction between the esophagus and that is called a sphincter.
When it comes to acid reflux, how should one understand the difference between gastric and acid reflux? Because usually people do have that confusion.
Yes, yes.
So, how do they understand?
It is very important to understand also, because the acidity, they have some periodicity. So they start getting the symptom only when they are hungry. And there are the other things. Earlier, this concept was very rigid, that gastric and duodenal, because there will be in that time there were plenty of cases having ulcers because of this acidity. So that is purely limited to the stomach. But when it comes to reflux, so it may present in n number of ways. People come to us just saying that no, night cough. Whenever I go to sleep, after 1 hour I start coughing. And there are few people who come to us saying that change of voice. So that again the change of voice is because of this acid getting trickled into their larynx. So and the symptom, the heartburn sensation is more common in patients with the reflux changes because the esophagus, the food pipe cannot tolerate the acid that is there in the stomach. Stomach can still tolerate.
Coming to yoga, yoga has a lot to do with breathing. So, how does it impact the overall ENT health?
Mainly the nose and the throat. So here I'm not very sure. Of course, there are certain studies at pranayama having a beneficial effect on the ear. There are research done on that. But of course, the nose and the throat, we have a definite benefit of performing, especially these pranayamas. So other yogas, of course, improves the overall, overall well-being of the person as a whole. But since this topic is related to ENT, the pranayama will have improved airway, and even with the slightest deviation, what I of course, if it is too much, then it is beyond control. But they can manage comfortably with the pranayamas, and there are few where there are few conditions where we advise certain yoga procedures after surgery, like Jalaneti. So Jalaneti is one of the another procedure that is performed in yoga where they wash the nasal cavities. That is a wonderful procedure done even after some certain surgeries for the sinusitis and the nasal polyposis. We advise them to do this Jalaneti so that the thick secretions is washed out, so that whatever the medicine what we give acts better.
How does snoring happen?
Snoring is due to vibration of our oropharyngeal structures. The oropharynx means the area beyond our mouth. So there we have the tonsils, and above there is a palate, and below there is a tongue base. So whenever we breathe through the mouth, these structures vibrate and produce an abnormal voice that is called snoring. And snoring is usually, if not always, because of obstruction in the nasal cavities. The person's nose is blocked, keep the mouth open, and this structure start vibrating. And there are two varieties of snoring what we call. One is the simple snoring, other is the obstructive sleep apnea. Simple snoring is person is comfortably sleeping without any problem, but only those who are sleeping with them will have problem because of this sound produced because of. But their as such health will remain good. The other way, people think that he is nicely snoring whole night and sleeping, but actually he is not sleeping but only snoring. So that will provide adverse effect on his own health. So that thing we need to differentiate this.
Okay. And when it comes to snoring, there are a number of strips which are available now in the market, which takes care. So, how healthy is that to be used?
Yes, snoring is not as simple as anyone thinks. Of course, if it is good, if it is that simple, and we pray for that, but not always these strips are going to help. There may be few where the problem is only with the nasal air, like this collapses and patient will breathe, will have a problem. But if it is the only thing, the strip will open it up and patient will breathe through the nose and his snoring gets reduced. But those are very few percentage of the people what we have, and it is very difficult to recommend those sitting here. And until we are sure that there is nothing major in the nasal cavities or somewhere down, we may not be able to recommend that. But every snoring person, if at all he is having any sleep disturbance or daytime sleepiness, uh, sitting in sitting when especially when they're sitting idle and snoring, and of course some people will start snoozing even when they are driving. So all those things need to be considered, and every snoring person, I recommend them to evaluate for any possibility of obstructive sleep apnea. Of course, nowadays we have some questionnaires where, based on this question, we can assess that whether there is a risk of obstructive sleep apnea or not. If they have then it is worth investigating and getting treated for their long-term health.
What is sleep paralysis?
Sleep paralysis are different. See, our sleep, when we go to sleep and till the time when we get up, it is not uniform. There are so many things happening in our brain to control this sleep. So in particular period may may last for seconds to minute, where our body, we lose complete control of our body. That is called sleep paralysis. That is not a very uncommon behavior that is commonly seen, and 1 in 8 of us will have that paralysis during particular time of the day, where even even if we wake up a bit, we won't be able to move our body. So, but after some time it recovers on its own when the cycle changes. So we don't have to worry about that unless this happens very frequently, and that signals evaluation.
What is the understanding of a sinus cycle?
Yeah, sinus cycle, see, as I mentioned, the nose is a complex structure. We have sinuses around the nose, and every sinus drain into the nose, and the junction between the nose and the sinus is a very tiny opening. The sinus is this big, and ultimately through a very tiny opening, it drains into the nasal cavity. And sinus is not just a hollow. Again, there is a lining inside the sinus, and that produces secretions. So imagine a person whose nasal cavity is blocked, either due to a common cold or it may be due to a deviation. So when the opening gets blocked, there will be secretions collected within the sinus. And whenever there is a collection of secretions, easy for a bacteria to go and strive there. So what happens? There is block, there is collection, there is infection. Now, whenever there is infection, the block worsens. So this cycle continues. That some people call it as a sinus cycle, which is different from the nasal cycle. If you are asking about the nasal cycle, that is different. So nasal cycle is the alternate congestion and decongestion of the nose. We have two nostrils, but both at a time, one will be predominantly functioning, so other will be dormant. So if our right is working now, the left may be dormant. It may be not active as the right. So this is because our nature has provided an opportunity for both the nasal cavities to work and not to get tired too much, and to maintain the hydration and other aspects of the nose.
So how do you identify the difference between sinus headaches and the migraine headaches?
Yeah, for ENT doctor, always we need to know what is migraine, even though that is a totally different aspect of it is to be managed by the neurologist. But we need to identify that, because the substantial amount of people who come to us for consultation think that they have sinusitis. Actually, they'll be having migraine. One thing about the sinusitis is, most, if not all, patients with sinusitis will have nasal symptoms, either a nasal block or nasal obstruction or something related to the nose. If never they had these symptoms, but they have only only headache, then we need to think that it is not primarily because of the nose. And of course, there may be some triggers. So this migraine will have some triggers. They'll tell that I get headache whenever I am exposed to bright light or loud sounds, or when I skip my meals, if I don't take water properly, there are some triggers. So when the headache is in that direction, it is likely that it is not sinusitis, but it is migraine, and we need to evaluate. We need to rule out that there is no sinusitis by doing a simple nasal endoscopy. And if we are convinced that there is no problem in the nose, then we can refer them for appropriate further treatment.
Coming to earphones and the headphones, which one's better?
If it is essential, then of course both are not that great, but of course nowadays it is essential. It's a part of our life. And the problem with the earphone, like, unless if it is not uh, gentle enough, it can cause a problem to our ear canal. And second, since we put it little inside, it may prevent the normal migration of the wax from the ear canal into the outside. Because if you want me to elaborate about the wax is normal secretion produced in our ear. So it is provided in one part of the ear and that comes out on its own along with the skin migration. But if we use a earphone continuously, that migration gets disturbed. So in that way, probably we can always go for ask for a headphone than the earphone. But of course, everything depends on the convenience of the need of that particular person. We cannot definitely strongly recommend anything for this.
You mentioned about the wax. So there are people who think that cleaning the wax regularly is good. Is it a myth or a fact?
There are particular fraction of people who get impacted wax. Say wax is otherwise a normal, I would say a normal secretion that is produced by the glands in our ear canal skin. So those specialized glands they produce some oil like thing that may remain as oil or it may solidify sooner or later. So if it solidifies, then again there is a possibility that it may come on its own or it may remain like that, remain there. So there are certain factors like there are since they are modified sweat glands, people who sweat a lot likely to produce wax, but need not be always. Like there are of course there are variations in the wax also. Those people who have a tendency of wax infection, it is always better that they get it checked frequently and get it cleaned from a specialist, because those people are the ones where they try to manipulate. It is likely that the wax may go inside and it may get impacted. If the wax get impacted, then of course sometimes it may be a disaster. Of course they have to suffer in the whole night without sleep, and it is always get better to get it clean from the specialist than manipulating ourselves. Otherwise, it should not be a routine that wax, even a drop, should be clean. So there is
So
nothing like that.
people do use their ear keys and other substances. So how do you as an ENT look at it?
Not recommended. I don't recommend at all using a sharp objectives. Even the use of this cotton buds, that is also not to be recommended, because the structure of the cotton bud is such a way that if there is any ball of wax, it is likely to push it inside than pull it outside. Again, for people who have a tendency of wax, they are not to be used. But otherwise, a normal person, there is no harm in cleaning the outside of the air canal with the buds. But any sharp objective should not be inserted into the air canal. It may damage either the skin, or if someone, meanwhile, when they are cleaning and someone hits the ear, it may even damage the tympanic membrane, and even later also. So I had a person, one mother, who was cleaning the ear with something, and the kid hit and she had to suffer a lot. She had almost 40-50 decibel loss of hearing also because of that. So those things, of course, these are the rarest of the situation, but even otherwise, it is not recommended.
Yeah. What are some of the most common issues that you see when it comes to stress and ENT?
Again, particularly to ENT, what we see is migraine. Like though it is not a pure ENT person, because since it is a shared specialty, migraine is one thing which is triggered by stress, and of course, stress is bad for anything. Other than that, as such, there is nothing which we deal with. But this acid reflux again. So people who are stressed likely to get this acid reflux quite often. So these are the two things. They're often named as a lifestyle diseases.
When it comes to diving or water related activities, what are the common problems that they face when it comes to the ear?
Yes. So there is something called barotrauma. So one condition probably what we have noticed, most of us would have noticed while landing of the aeroplane. So we get a block sensation in the ear. The same thing can happen when diving. So when we dive, we are going from a low pressure to a high pressure area, and the tube which maintains the pressure, that is the eustachian tube, if it is not functioning properly, then suddenly there may be negative pressure created in the mid layer, and that may cause a problem in the mid layer. That is one. that is diving. And since you also asked about the water activities, I would like to stress on something called the infection of the external ear. See, ear canal is a 1 inch structure which ends at the tympanic membrane. If the tympanic membrane, the eardrum is normal, even then, especially in our Mangalore and coastal areas, we tend to get one infection called otitis externa, especially caused by fungus. That is called otomycosis. These fungal infections are more common in people who go for water activities if it is not dried properly. And those with the tympanic membrane perforation, they should not go into these water activities without particular precautions.
What are swimming ears? They usually.
Swimmers ear, yeah.
Yeah.
So swimmers ear is what I mentioned. That is otitis externa. So that is the infection of the external ear because of the water entry, frequent water entry into the external ear.
And how should they protect it?
As such, they need, see, whenever they have the infection, absolutely they should avoid swimming. Unless it is something like tomorrow there is a competition, I have to go. That is exceptional situation. Otherwise, better we avoid going to swimming when we have infection in the ear canal, and only after the entire ear is sterile, the infection is controlled, then only we should go for swimming. And those who have a tendency of swimmers here should take particular precautions in the form of ear plugs, which prevent the entry of water into the ear canal. But of course, again, there are so much of variation among these plugs. If we use a snugly fitting plug which absolutely controls ear, then it is worth using it.
So some people get the in a later stage they get a hole in the eardrum. How does that happen?
Yes. So hole in the eardrum can happen even in early childhood. So in fact, it is more common in early childhood by by a middle ear infection, like uh, in children especially. Uh, the infection in the nose and the throat can easily ascend to the ear through the eustachian tube, which is a connection between the ear and the nose. So whenever this organism enter the middle ear, they cause infection, and there will be pus formation within the middle ear, and the pressure is so much that the tympanic membrane is, or the eardrum is the only area which it can come out. So it forms a small hole and comes out. But most of these kids, this perforation will heal on its own when the infection is controlled. But there will be few unfortunate where the perforation is too big or the infection took very long time to control. That time, this will lead to a condition called permanent perforation syndrome. So the inner layer and the outer layer of the tympanic membrane or the eardrum, it fuses, and hence there is a rim around the hole, and that will prevent the hole from healing. So those people, which they'll usually get either the hard of hearing, they'll feel that their one ear is not as proper as other ear. Second, with every cold or when they go for any water activities, they'll start having discharge from the ear. And the those particular patients, we need special precaution. And of course, it is essential for them to have a consultation and to see what is the situation of the, once it is diagnosed that they have a hole on the tympanic membrane or the eardrum, they need to have a confirmation again, saying that whether it is healed or still it is persistent, and depending on that, they have to take the advices.
When it comes to fracture, what are the common fractures that you see in the ENT area?
ENT, again, see, our head, whenever a small fall, the first place to hit is the nose. So nose, the it is formed by a bone which is very thin like a paper. So nasal bone are one of the common fractures what we see in ENT. But apart from the nasal bones, we also see some other fractures which are sometimes life threatening. This bone, the around the ear, that is called a temporal bone. When a person falls, especially in people who travel who ride a two-wheeler and they don't wear the helmets, so these people are at higher risk of developing these fractures of the mandible, this jawbone, and the fractures of the temporal bone. The temporal bone fractures may be life-threatening because there are important structures just inside this temporal bone, and they may bleed heavily, and they may even have a life threatening situation there. But apart from that, some important structures are situated within the bone, like our inner ear, the damage to inner ear, we may lose the hearing. Important nerve which supplies the face, that is called facial nerve, that may get cut when there is a fracture, and person may get a tilted face like a facial nerve palsy. And mandible fracture is one thing. Usually just a fall like this can cause a fracture of the different part of the body, because it is weird bone, like it goes from one side, travels the entire force, and forms two joints in a single. So any weak area may get fractured, and that can cause a functional disturbance while chewing, and also chewing. And these need to be recognized and managed appropriately.
How do you see the transition of new technologies? How is that helping the advanced treatment for ENT?
Different aspects here, like, see, ENT, we think in two ways. One is a surgical and other is a non-surgical. So when we come to surgical, when we were undergraduate student, when I was doing MBBS, of course, hardly 29 years back. So it was not that advanced. Last 2 decades, there are tremendous development in the any field, of course, medicine, especially when it comes to ENT. The endoscope have made the revolution. So endoscope now, many procedures which we were opening externally are being managed endoscopically. Even during the COVID time, probably you would have heard of something called mucormycosis, black fungus. We have managed most of the patients successfully using endoscopes only. So we have other gadgets like coblation, where we burn the tissues with the very less temperature. So all those things are the revolutions. And there are nowadays we have robots. So robotic surgery has a next level of revolution. Of course, we are not expert in that till now. Of course, there are expert in Mangalore also in the robotic surgeries. The robotic assisted thyroid surgery, they are quite common in certain areas. Of course, sooner or later, even we may become expert in that. That is with respect to the surgical aspect. In non-surgical, we have, like, of course, I can call it as a surgical also, because a newborn hearing, 4 5 decades ago, a baby born without hearing is like lifelong deaf and dumb. But now it is not like that. So now even the government, they insist on a hearing test for the newborn. We have the facility to diagnose this hearing of a newborn and say that this baby can hear. And based on that, we can, in case if we detect the baby is not able to hear, we can rehabilitate, we can do a surgery called cochlear implant at a very age, even at the age of 2 years, and give a normal hearing and later speech to the kid. So these are certain revolutions. Of course, there are so many things to tell. Of course, it is worth implementing the technology with our knowledge of the medical science.
When it comes to painkillers, some people use painkillers on regular basis because they experience headache as well as sinus. So how do you see the side effects of it?
Always, see, in our country, of course, I'm not blaming the legislation, but the people themselves. This the medicines are available very easily. If you go to Western countries, some countries where even to get a simple medication, they need to wait for days. But here it is not like that. Just to go and get a tablet, and as much as possible you can buy and swallow. And on the long term, the main problem of this painkiller is the kidney, and kidneys are badly affected by these painkillers, and we don't recommend painkillers for a very long period. And in case if a person needs painkiller very often, that means they need further evaluation to know the cause of the pain and alternate medications to prevent the pain. There are alternate medications which can be safely given to the patients even daily, but they won't cause any harm to the organs of the body. But as such a painkiller, they are not to be recommended on a daily basis.
When it comes to young parents, what should they take care when it comes to the ENT sector?
uh, Young parents, I would say expecting parents, will start from there. Okay, expecting parents, they should not hesitate to get their ear tested as soon as the child is born. Of course, now it is not very difficult, it is mandatory. And second is, if there is any high risk parents, like either they uh, elderly parents, of course, and their family having some issues with the hearing and all, they need to be specifically aware of these possibilities without any hesitation. Of course, there is a stigma like, oh no, no, if we test, if something happens, that should not be there in their mind, and they should comfortably get their uh, uh, get the hearing assessment of the kids done very well. And second is, the in childhood, see, one of the common problem what we tend to ignore is that the frequent cold because of the adenoid hypertrophy, and this causing hearing loss, that is most of the time ignored. And up to 30-40 decibels, they may not tell, only they may not notice that they have hearing loss because they can't tell. So they uh, when sitting at home, they unnecessarily they increase the volume of the TV, and they speak loudly. And so whenever they see any such things, they should not hesitate to have their kids hearing tested. That is one thing what I would strongly recommend for the expecting as well as the young kids. And other than that, the snoring and all, the snoring doesn't mean that the kid is comfortably sleeping, so that means he's sleeping with some difficulty, so we need to evaluate for that.
When it comes to rare diseases, what are some of the rare diseases which you have seen associated to ENT?
uh, it's rare. Again, the rarity changes from place to place. The rare disease what we see during our post graduation in Ahmedabad may not be rare in Mangalore. So they're having a rhinosporidosis infection. So then it's an infection of the nasal cavity, which was a very rare thing. But here, since the geographical locality, so we see a lot of rhinosporidosis here in Mangalore. And some cases, if you are to tell the condition, one of the interesting condition what I had seen almost 10-12 years back, is that a mother got a kid saying that kid has swallowed the coin. And naturally we get the x-ray done. Absolutely, there was no coin from the neck to the abdomen, to the stomach, thorax as well as abdomen. We were surprised. Where did the coin go? They are sure that it. Then, when we asked, the mother had tried to manipulate the coin inside the mouth. Then we got the X-ray of the head done, and this had gone up, and that was sitting behind the nose. So these are some weird conditions where, and otherwise, if you had not asked the patient mother again that history, probably would have sent her home, and patient would have gone to some other doctor, and that doctor would have diagnosed that the coin is there behind the nose. So these are some interesting cases what I found. But one more thing is, the time has taught us lesson. Like COVID, we never thought the ENT surgeon will be in the limelight during the COVID period until the second wave, because suddenly there was a surge of mucormycosis, a black fungus, which is a dreaded condition. Till 2019, in our case at the hospital, I would not have seen more than 10 cases of mucormycosis. And suddenly, in 1 year, we would have seen some 25 cases of mucormycosis. And thankfully, we had managed it very well because as we had a team, though initially we had a scarcity of medication for that. So that is one thing I would say, the rare become a common suddenly.
Yes. And what are some of the most common misconceptions that you've heard on a day to day basis when it comes to ENT?
Yes. So probably, even though not day to day, but definitely I had come to one condition where even I have puzzled many times myself, that people come to us saying that, doctor, I hardly get a cold. So ತುಳು ಹೆಂಗ್ ಶೀತನೇ ಆಗೋದು doctor ಅಂತ ಹೇಳಿ. So that is one thing that is not a real condition. What they say is, what they think is, if there is something discharging out of the nose, that is good. That means their nose and the sinuses and the entire head is getting clear. Definitely it is not the correct assumption. And it is definitely it is an assumption only, and it is wrong. So having a cold is need not be good. So having cold is in fact a nuisance than not having it.
So it's okay to not have
Yeah,
cold.
definitely not.
Yes,
Definitely
yes,
not.
yes. Could you please explain us about black fungus?
Yeah, black fungus. Yeah, and probably most of us know this, at least heard of this black fungus after 2020, after the COVID associated thing. This is a rare, it's a common fungus. I wouldn't say the rare fungus. It is seen probably if I go on searching in our Kadri area only, we can easily find it in the soil. But it won't cause disease unless it reaches the favorable environment. The high risk factors for black fungus are the diabetics, but not all diabetes, uncontrolled diabetes. Second, the people who are on immunosuppressive drug, like people who have undergone organ transplantation, kidney transplantation and liver transplant, any other organ transplantation. Whenever at organ transplantation, then we need to keep our immunity low of the patient, sorry, by introducing some, giving some medications. So which will lower the immunity of the patient so that the organ is not rejected. Because the immunity of the person can reject the organ which has taken from some other person. So those patients are the victims of this black fungus. Though the fungus is not black, the disease caused because of the fungus is black. It will destroy the structures which it affect. First, it attacks the blood vessels and it stops the blood supply to that particular area. Then it spreads to the next area. So entire structure becomes black because of the lack of blood supply. And until we take out the entire dead tissues and and we give antifungal medication, there are particular medication, and unfortunately those medications which are given are equally toxic. So we give a drug called amphotericin B. We had a scarcity of this during our COVID associated mucormycosis initially. Of course, the government acted rapidly and gave us the supply within a month. But uh, those drugs are also toxic, and they can in fact cause damage to the kidneys, unfortunately. So it is like a balance between treating and the medication. The problem caused by the disease and the problem expected by the drugs. But surgery and medication and long-term treatment is the key for this black fungus or mucormycosis. And of course, touch wood, we could comfortably manage it, at least in Mangalore.
So, how should one identify black fungus? What are the symptoms or initial things that happens to a patient?
There may not be any specific symptom also. They may just come with the pain or the nose block. But it is the responsibility of the clinician to diagnose it. Here, the person is innocent, doesn't know anything. But if I fail to diagnose the black fungus in the early stage, then it is a crime. I have to, the first contact person have to keep this in mind, even though the patient, of course, patient responsibility only to visit the person and to see if there is an issue. The moment I see any black thing, then I have to take a small bit and send for testing. So by this, we can comfortably diagnose this mucormycosis or black fungus with some special stains, and we can initiate the treatment as early as possible. The early treatment is the key in black fungus infection.
Right. And does the skin turn black or anything of
Exactly.
that sort?
See, the skin in the first, the inside, the nasal mucosa becomes black. When it start expanding, entire the face becomes black. So the all those black things had to be removed and reconstructed with the other structures.
And how rapidly does that grow?
It can go overnight in unfortunate people, but it is not that rapid in otherwise healthy people. And but it is essential to keep a watch on the progress and remove with each expanding dead tissue. So the removal of the dead tissue is very important because that will not allow the drug to reach there. Any dead tissue is devoid of any blood supply, and it won't allow the drug to act.
Right. And when it comes to black fungus, once removed, does that reoccur again?
Usually, see, the issue here is removal of the dead tissue is the treatment what is done, but the rest is done with the drugs being given. So there is a particular duration for each site. So we need to give this much gram of amphotericin B, followed by we give tablet now, because there are advances in that also. We have tablets in the form of posaconazole, which we give for weeks together, and we make sure with the serial endoscopy to make sure that there is no new things happening, and by that we can say that there is no more further treatment is required. Of course, even now, even in 2024, we get the patients coming for follow them, and we really appreciate them for coming them for follow.
Right. So, what is one message you would like to give our general public? How should they take care when it comes to ENT?
Yeah, ENT, of course, it is a complex structure. Like many times, we won't see what is happening inside, and we can't ask our household people to see what is there inside. It is not very easy. And any ear conditions, we need one thing. What is important is to protect our ear from loud noise. So avoid loud noise is one thing which I always advise, because we have a one project called Nishabda in our Dissect hospital, where we promote we promote avoiding
Loud
promote to
noises.
avoid loud noise, and we screen people who are at a high risk of developing noise-induced hearing loss, because a pleasant one, if it crosses the limit, can become unpleasant, and of course it may become dangerous also. That is one thing. And next thing is, grow some greeneries around you and have good air, breathe fresh air every day, and avoid smoke. Very difficult to tell those who are addicted, but definitely it is not impossible to this one. And addictive agents are uh, falling to addiction is one more thing which can comfortably avoid many diseases related to the ear, because smoke is one thing which can kill the person as well as the family.
I hope you all enjoyed today's episode. Until next time, do let us know in the comment section which was your favorite episode till date and which episode or topic are you waiting for. Bye bye, take care.